Hi guys, hope you're surviving this COVID-19 crisis. I had a couple of calls this weekend about a similar thing, so I wanted to review some troubleshooting steps when you have a phase 1 treatment and your wire pops out in the back. So this is a set of phase 1 braces, which is something that is fairly common with our patients who are younger and in the phase 1 treatment. There is a brace in the back on each side and then a span of teeth without braces on them. And a lot of times that's because there are baby teeth or grown-up teeth growing in. And then there's a couple of braces in the front and then in the back. If you are chewing and you eat food, I'll try to bring this a little bit closer. So if you are chewing food, the wire can pop out in the back. And then it's kind of dangling and uncomfortable back there. Sometimes we have springs on it. We call them pushing springs. So I don't know if you can see this spring here. So on the other side, I did not put a spring just for demonstration purposes. The best thing to do in this case is to take the wire and to line it up with a little tube. There's a little tube, a hole, and you just slide the wire back into the brace. And sometimes you do have to bring the spring forward in order to do that. Worst case scenario, if the wire pops out and it's hanging there and it's very uncomfortable and you can't line it back up, you can actually take the spring off. Just slide it out the back of the mouth and remove it, and we'll put that back on in the future, and then try to put the wire back in the little hole. And if you do that, you sometimes have to pull it out a little bit towards your cheek to bring it forward and then to push it back. If that doesn't work, you can leave it out of the tube and it'll just wiggle around a little bit and be uncomfortable. Or if that's bothering you and you can't secure it with wax, you can get some nail clippers, and you would just take those, make sure they're clean, and you would clip the wire behind the brace that is the last one towards where it's still attached. So it's going to be fairly heavy, so you have to clip it, and you'll feel it cut through, and then you'll just remove that piece of wire. You may have to do it more than once. There we go. And then the wire is off. Now, depending on where you cut it, that may be a little bit sharp there. So you would possibly need some wax in that area to make that sharp end not feel quite so sharp. There are some braces in the back that we have. The tube on the actual brace has a door, a sliding door. And that sometimes comes open. So this is just a big example, a big model of that, if you imagine that on your tooth in the back. So it's open. And you go to put the wire in, the wire won't stay because it just comes in and out because the door is open. So in that case, what you may need to do in the back of the mouth, if you see that it's an open slot like this, you may just need to push up from the bottom of the brace to the top of the brace like this to close that door or the gate. And then you'll make a little hole in the back. And if you have that little hole in the back, then all you need to do is put the wire through there. And then that would take care of the wire wiggling around or bothering you in the back. Hopefully that made a lot of sense. I am trying to demonstrate without getting too close. So good luck, and text me if you need anything. I am here to help. It's very helpful to have pictures because then I can zoom in and circle exactly on your teeth what I need to help you with. So please keep the pictures coming, and stay safe in this coronavirus. Stay at home, wash your hands, make sure your hands are clean before you put them in your mouth. Take care. Can't wait to see you again.